Hi, hello everyone. This is Monica from Final Year Biomedical Engineering. So today I am here to explain about the functional electrical stimulation in rehab. So the introduction. So first of all, what is meant by rehabilitation? It is an important for patient who lost the movement due to injury, stroke, or neurological disorders. In many cases, muscles do not receive a proper signal from the brain. Functional electrical stimulation helps overcome this problem by providing artificial electrical stimulation to achieve the muscles and improve movements. What is FES? So the functional electrical stimulation is shortly called as FES, is technique which small electrical impulses are applied to our muscles to produce contraction. It is mainly used in patients who have a paralysis or weak muscles. FES helps to restore the functions and supports patients in performing daily activities independently. They do not depend anyone for their personal activities. So, what is the basic principle? It is to replace the natural nerve signals with artificial electrical stimulation. When electrical pulses are applied to the muscles, they contract and produce movements. This helps patients regain functions like walking, grasping, and lifting objects. Need for FES in rehab. The FES is needed because many patients suffer from loss of muscle control due to nerve damage. Without proper stimulation, muscles become weak and inactive. FES helps in maintaining a muscle strength, improving blood circulation, and preventing muscle wasting. So, the components of FES system. It consists of stimulators, electrodes, and control unit and power supply. The stimulator generates electrical pulses, and electrodes deliver the pulses to the muscles, and the control unit regulates the stimulation. These components work together to produce a controlled muscle movement. So the types of electrode. There are different types of electrodes used in FES system. First of all, the surface electrodes are placed on the skin, and implanted electrodes are placed inside the body, and the percutaneous electrodes are inserted through the skin. Each type has its own advantage depending on the applications. So, working. The working involves generating electrical signals using a stimulator and delivering them through the electrodes to the target muscles. These signals cause the muscles to contract and produce movements. Repeated stimulation helps improve muscle strength and coordination over time. FES in stroke rehab. In stroke patients, the FES helps to restore movements in affected limbs. It improves muscle activity, reduces stiffness, and helps patients regain control over their arms and legs. This therapy plays a major role in improving recovery after stroke. So, in spinal cord injury, it helps stimulate muscles that are not controlled by the brain. It enables activities such as standing, walking, and cycling. It is also improve the blood circulation and prevent muscles atrophy. In upper limb rehab, it is used to improve the hand and arm movement in patients with the weak or paralyzed upper limbs. It helps in improving grip strength and coordination, allowing patients to perform activities like holding objects and writing. In lower limb rehab, it helps the patients regain walking ability and balance. It is used in gait training to improve movements patterns and coordination, especially in patients with neurological disorders. Advantages. The FES have several advantages such as improving muscle strength, restoring movements, and enhancing patient independence. It is a non-invasive technique when surface electrodes are used and can significantly improve the quality of life of patients. Limitation. Despite its benefits, FES has some limitations. It requires a proper training and supervision, may cause discomfort, and can be expensive. In some cases, it may not provide a complete control over muscle movements. Future scope of FES is promising with developments such as brain control stimulation systems and advanced sensors. These technologies will provide more accurate and natural movements, making rehab more effective. So, the overall conclusion, the FES system is an effective rehab technique that helps restore muscle function and improve improvements. It plays a vital role in improving the quality of life of patients and will continue to evolve with technological advancements. Thank you, all of you.